Today we are going to discuss about how asthma in women affects differently. So asthma is a chronic inflammatory disease of the airways, and we know that millions of people suffer from asthma worldwide. It is seen that almost 34 million cases of asthma happen in India annually, which account for about 13% of the global burden of asthma. If we talk about women, we have seen that as the age progresses, or adult women suffer from more asthma as compared to males, and not only suffer from asthma, but if we look at the symptoms, that symptoms of asthma tend to be more severe in females. They tend to have more frequent flare-ups. They tend to have a poor controlled asthma. There are more hospital visits or hospitalizations due to asthma, and there is a higher risk of death or mortality, which is more in women as compared to males. We have seen that women are homemakers and they primarily are working in the home. And if we look at the exposures, firstly I'll come to the pollen exposure, the food exposure, and smoke and dust exposure, which is more in the houses because they are cooking or they are doing dusting or they are cleaning the house, so they are more exposed to these stimulus or triggers within the house. Then comes the various hormonal influences which are very common in females, like at the time of puberty, at the time of menstruation, at the time of pregnancy, at the time of menopause, females who are taking oral contraceptives or females who are taking hormone replacement therapies. All these phases of life, there are changes in the body, changes in the hormones of the female body, which increase the female sensitivity to develop asthma or difficult to control asthma, which is very common. So we have to take care of these stages and remember that these stages can influence the outcome of asthma in these kind of patients. Apart from asthma symptoms, females during these various phases of life tend to have some atypical symptoms which are associated with asthma, like they have more headaches, acne, eczema, joint pain, and mood swings during these phases. So the important thing to remember is that to manage asthma in females, it is not very difficult because the management guidelines, the management principles are the same and the medicines are the same. You are prescribed the same inhalers, you are prescribed the same tablets by the doctors. Important thing is to remember that you have to identify your triggers, because trigger is something which can make your asthma worse anytime. So if you are allergic to pollen, dust, smoke, or any agarbattis, dhoopbattis in the household, you should take care of that. And during your various changes, like during puberty or menstruation or menopause, if any female is having asthma symptoms or has pre-existing asthma, then please remember that asthma can worsen during these phases and you have to get regular checkup by the doctor or get an individualized asthma action plan made for you, so that in case you experience signs symptoms of worsening during these phases, you can preemptively treat yourself and manage your asthma exacerbation. Plus, vaccination is very important. Every female should undergo the vaccinations as prescribed by the doctors. These may include influenza, pneumococcal vaccine, or COVID vaccines, which are easily available in the market.